Hello, I'm Zach, and this is a video about radial nerve mobilizations. And you might be given radial nerve mobilizations if you have nerve-related symptoms that happen kind of in your first two fingers along the back and side of your forearm and maybe on up to your elbow. So I've got my little string here. The radial nerve starts from a bunch of nerve roots in your neck kind of coming together around, forming in your brachial plexus, and then it kind of comes around the back of your arm, under your triceps, along the side of your forearm, and down basically to your finger, and your first finger and your thumb. So if I have this right here, and I bend my wrist and twist my arm inwards and bring my head over to the left, you can kind of see how that puts a maximum stretch onto that nerve. And if you do this, you may start to actually feel a little bit of symptoms in those areas, some discomfort, uncomfortable stretch, even if you don't have an actual issue. That's a normal response for that to happen. So that's what's going to stretch it the most. And that means that if we want to mobilize it, we're going to try to add tension in one place while taking it out in another. So for instance, if I bend my wrist, I will add tension here, but if I also bend my elbow, I will take away tension here. So by working with those few things, combining those in different ways, we can cause that nerve to kind of move back and forth along its course. That would be a nerve mobilization. So a few options for you are like the one I just described. If you bend your wrist at the same time as you bend your elbow, and then bend your wrist the other way at the same time as you straighten it, that will be a radial nerve mobilization. Okay? You can get your whole arm into it, including your neck. So again, this is the stretch right here. If I want to mobilize, I can twist my arm inwards at the same time as I bring my head over to the right. So combining those two kind of movements, twist inwards, bring my head to the right, just like that. I can also keep this position right here of maximum stretch and push my shoulder blade down. That's going to stretch it. You can see it's going to stretch it here. But I'm also going to bring my head over to the right and take away some of that stretch. So we can go like that, shoulder blade down, tilting your head towards your shoulder. Just like that. Okay, so that's a few options for you for a radial nerve mobilization.